Hello, my name is Dr. Ryan Naujoks. I'm an orthopedic surgeon. I practice with Orthopedic Associates of Middletown. My practice is located here in Middletown, in Marlborough, and Westbrook. When I was in medical school, I ultimately decided to pursue orthopedic surgery for my training. I like the focus on restoring function. I also like the types of problems I see. It's very rewarding to take a broken bone, something that was broken, and put it back together and fix it. And I find it very rewarding to be able to take a patient that maybe couldn't walk, maybe couldn't write, or couldn't do some activity and restore them to the function that they want to get back to. I specifically chose extra training in hand and upper extremity surgery. Carpal tunnel syndrome, which is a pinched nerve at the hand and wrist, can often cause numbness in the thumb, the index finger, and the middle finger. It can also sometimes cause some weakness of the thumb. The good news is there's many different ways of treating carpal tunnel. Some patients can be treated with a simple brace on their wrist. Some patients we treat with a cortisone injection, and sometimes there's reasons to do surgery to treat carpal tunnel. Arthritis in the hand and wrist is a pretty common issue that we see. One of the most common areas is at the bottom of the thumb. It's a very common place to get arthritis. The thumb can be stressed or hurt when patients open jars, turn doorknobs, things like that. The good news is there's a lot of different ways to treat arthritis of the hand and thumb. Dupuytren's contracture is a pretty rare problem, but as a hand surgeon, it's something I see commonly. Patients can get a problem where their body makes too much scar tissue inside the hand, and what that does is over time it actually causes their fingers to become very stiff. It's scar tissue that's kind of out of control. It happens on its own. When this happens, it can be very hard to put your hand in your pocket. It can be hard to put gloves on. It can be hard to hold change or hold coins. For the treatment of Dupuytren's contracture, I am proud to be one of the few doctors in Connecticut that treats it with a procedure called needle aponeurotomy. Needle aponeurotomy is a very effective way of treating Dupuytren's contracture because it doesn't involve any incisions in the skin. The recovery is very rapid and patients return to their function able to use their hands and fingers. I'm originally a Connecticut native. I was fortunate enough to come back to Connecticut for my medical training. I went to medical school at the University of Connecticut. The University of Connecticut also has an excellent orthopedic residency program. I was able to stay here and complete my orthopedic residency. I joined Orthopedic Associates of Middletown because of the camaraderie of the doctors here. As surgeons, we all work independently, but when I need help, when I have a question, I can rely on my partners and we work well together. I think the thing that sets the Orthopedic Associates of Middletown apart is that we spend a lot of extra time with our patients. We'll make sure that we obtain the correct diagnosis, determine a treatment plan that is correct for that particular patient, and really addresses all of their needs, all of their desires to address the underlying problem.